and welcome everyone to today's Synergist webinar, What's New with Ethylene Oxide, Update from ITRC and EPA. I'm Kay Bechtold, Managing Editor of the Synergist, the magazine of AIHA. I'd like to thank everyone for joining us today, and especially SGS Galson for sponsoring this webinar. Today's speaker is Ed Stuber, Industrial Hygiene Portfolio Lead for SGS North America. He has practical experience and expertise in the areas of industrial hygiene consultation and regulatory compliance, indoor air quality, lead well investigations, and surveys from a laboratory perspective. He has worked with both U.S. and global clients to assist them regarding industrial hygiene technology, sampling plans, training, and regulatory interpretation, as well as IAQ investigations. Ed has over 40 years of experience in industrial hygiene laboratory operations and is responsible for supporting industrial hygiene clientele and technical consultation for IH sampling and analysis projects. And now I'll go ahead and turn the presentation over to Ed.
Okay, hopefully everyone can hear me. If not, I'm sure that there'll be some messages in the chat. First of all, I want to thank AIHA for this opportunity to give this webinar. Hopefully you'll get something out of it. I know I did when I was putting it together, and looking forward to presenting the information. So the agenda here, first part of it will be an overview. I think most all of you, if not all of you, are going to be familiar with ethylene oxide, what it is, what the uses are, a little bit of history, some information regarding the exposures and that. But I wanted to just get that out there to everyone before we get into the ITRC update, the latest information in regards to what the EPA has in store. And then I'm also throwing in some information about the FDA and ETO innovation challenges that they started, but you'll see what happened to them when we get to that point. So that's the agenda for today, and hopefully we can get through this, and we'll have questions at the end. So all about ethylene oxide, or ETO. So ethylene oxide, if you're not familiar with it, it's a flammable, colorless gas. It's used to make many, many other chemicals, primarily antifreeze, but it's also used in textiles, plastics, detergents, adhesives. It's really an unknown precursor to a lot of products that we use on a daily basis. In addition to that, it's also used with sterilization, as you'll see, in sterilization in the manufacturing of two big sources of ETO in the atmosphere. So we're going to be talking a little bit about ethylene oxide emissions in the atmosphere, where the EPA is involved in the regulations of those, and also very little bit about personal exposures that are involved with the workers that are dealing with ethylene oxide in the sterilization and the manufacturing use of mid-1800s. Shortly after that, they started finding the use for ethylene oxide in the production of ethylene glycol. And as you know, ethylene glycol is used primarily as an antifreeze in automobiles, refrigeration, et cetera. And even later on, at the beginning of the WW2, they started using it as a sterilization gas for medical equipment, sterilization of gauzes, of surgical scalpels, needles, etc. So that was the first major use during the World War II. So in 2019, which I know is 4 years or so ago now, but production has not really gone down. But 2.8 metric tons of this gas, and you think of a metric ton and then almost 3 metric tons, and this is a gas. So how much is, I mean, that's a tremendous amount of gas that is being produced and being produced, you know, in a yearly basis because of the fact that it's a gas and there's 3 tons of it. It's quite phenomenal. Again, going back over the uses of this chemical, the manufacturing of other chemicals with 97% of it going toward the antifreeze use. Sterilization of equipment now, you know, we're not using it out in the field, but more in the hospitals and urgent cares, that type of situation. And then very few uses are being done for the fumigation of spices and other edible products. So why are we concerned about exposure to ethylene oxide? Well, there's quite a lot that we should be concerned about. It's classified as a mutagen, which makes mutations because of the disruption of the DNA, the recombining of the genes, central nervous system depressant, and chronic exposure can lead to permanent damage to your central nervous system, your brain, etc. So chronic exposure, if you're not protected, for your eyes, your skin, your lungs. So it's not only a respiratory irritant and problem, but also contact. So the skin and eyes need to be protected. And then in 2008, the IARC, which we're going to be talking about, the International Agency for the Research of Cancer, classified it as a class 1 carcinogen linked to these types of cancers, breast cancer, leukemia, and non-Hodgkin lymphoma. So it's a bad actor, I guess you could call it. You know, even though we do use a lot of it and for good uses, there's problems with using it that we need to take these precautions and be aware of. So the U.S. EPA, based upon the National Air Toxic Assessment, that there's a problem with ETO, and it's been classified since 2016 by the EPA as a human carcinogen. And there's the document that was released back in 2016, and at the same time they lowered that limit to 0.2 parts per billion. Now, the limit that the EPA is putting out there is for the public, and the public is going to be much different than the worker population, and you'll see that when we get to the next slide or so. But there was a test conducted by the EPA in 2018 where elevated levels of ETO were found. Now, since then, there's been some reevaluation of that data as to what the background is of ETO and what the background is of ETO throughout the United States, because it is naturally occurring. It can be also found from other sources rather than just the sterilization or the chemical plants. And also back in that early day of testing in the 2018 era there, we were unaware, we being laboratories and research organizations, we were not fully aware of some of the chemistry involved in the testing of ETO and the way that it was being quantified. And there was found to be an interference, a co-elutor of a compound that would give you false or biased high results for ETO. The methods have since been refined. Other analytical techniques have been developed, and that's no longer an issue. But back then, it was unknown. But it's been the bugs have been worked out, and things seem to be on track now. So here, let's look at the comparison between occupational exposures, OSHA, Occupational Safety and Health Administration, permissible exposure limit. You can see that it is much higher than the ambient air allowable limits that the EPA has put out there. We're looking at, if you're a worker, which means you typically can be exposed to that chemical for 8 hours a day, 5 days a week, 20 years exposure, and your risk would be minimum. And that's at 1 part per million. And you're looking at, 0.045 as a detection limit for some of the methods over there on the ambient air monitoring, and the 0.2 part per billion that would be looking for in the EPA. The ACGIH, which typically would be, a lot of times it's got a lower limit that's a value, but in this case it's the same analytical limit as the OSHA PEL. The OSHA PEL is the law, is what needs to be met by all employers for their employees that they're going to be exposed to ETO. ACGIH is recommended exposure limits, threshold limit values. It's not law, but in this case, they're both the same. The analytical method for your personal exposures, you can use a couple of different ways, using hydrogen bromide coated tubes and a GC with an electron capture detector, looking at a typical detection limit of 0.6 micrograms, or you could use passive monitors. You can see that the passive monitor there, it's easier to use as a collection technique, and you would think, well, the limit of quantitation, 3 micrograms, is quite higher than the LOQ for the 0.6 versus the Pubman 2. Either one would be fine as long as you are collecting enough air, but the pump and tube method is going to be the way to go when you're looking at potential exposures for your personnel. Ethylene oxide is not analyzed directly. The reason you have the HBr coating on the tube is to derivatize your ETO to the bromoethanol, and that's what's being analyzed and then calculated back through a formula to the ETO exposure. On the ambient air side, they're using, they being EPA and anybody who's doing ambient air testing, fence line monitoring in the neighborhood around chemical plants or sterilization facilities, hospitals, et cetera. They're going to be using evacuated canisters. The evacuated canister, if you're not familiar with it, typically is going to be EPA Toxic Organic Method 15, TO15 or TO15A. It's essentially a steel cylinder that has been evacuated to about 30 inches of mercury, and then a flow restrictor timer is put onto it, and the air is sucked into the canister over a specific time period. Then, so you're not stripping anything out of the air, you're collecting the whole air. It goes to the laboratory, it's then analyzed by a GC mass spec. So now you've got much more of a tremendous quantification detection, and you're looking at much less potential interferences because of the mass spectra that is being done. So it's a great analytical technique. Labs that do industrial hygiene type work, air work, they would or should be able to deal with your OSHA analytical methods, whether it's a badge or a pump and tube, but they may not have the ability to analyze evacuated canisters. And even if they do have that capability of analyzing canisters, they may not have EPA TO15 for ethylene oxide developed and accredited. TO15 typically has a list of 61 or so VOCs that are made up for the method. You can adapt that method for many other VOCs within a certain carbon chain length, but ETO is going to be outside of that realm of what typically would be done. So a very concentrated effort to develop a method for ETO using canisters has to be done by your laboratory, and you want to make sure that they, they're just not going to take your sample and and run it without having that qualification of that method. So where do we find, or why is there ETO in the air? What is, where do we find this? Well, there's always going to be fugitive emissions from either, here we're talking about chemical plants, and we're talking about sterilization facilities. But whenever you see, not all the time, everything that you see coming out of a stack, out of a stationary source, is not going to be particulate, it's not going to be the VOCs, it's not going to be ethylene oxide, et cetera. A lot of it is steam type thing, but ethylene oxide is a non-visible gas, so even if nothing is you see coming out of stacks, doesn't mean that there's not anything coming out that's going to be harmful. But fugitive emissions of chemicals like ethylene glycol, fugitive emissions during the sterilization process of medical equipment, and the fumigation of spices. And since you're not only are these fugitive emissions from those processes, you're using these medical pieces of equipment and the spices, et cetera. They need to off-gas any residual ethylene oxide that might be adhered to them. So at some point, that off-gassing is also contributing to your ethylene oxide in the atmosphere. You're going to get some ethylene oxide from the combustion byproduct and unused hydrocarbon fuels, which means gasoline. And as you know, there's been a tremendous push now to reduce the carbon footprint here on Earth, everywhere throughout the Earth. And with the climate change, that's the direct result of the greenhouse gases. This is going to be good for the reduction of the ethylene oxide from the hydrocarbon fuels. Electric cars are coming in, reducing the need for the use of hydrocarbons, so that's a good thing. Cigarette smoke, just about any chemical that's out there is going to be found in cigarette smoke. There's just hundreds and hundreds of them. They're in small quantities. As the world goes more and more away from smoking, but now they're going to vaping. I don't know if there's been any looking into the possible ethylene oxide in vape products, but there probably is in some, but don't quote me on that. It's just a hunch. But anyway, cigarette smoke also contributes to ethylene oxide out there. And just us being humans and the metabolism that we have, if we intake ethylene, which is very possible from sources that ethylene might be in the air or from food products, et cetera, the breakdown of that ethylene can produce ethylene oxide. So you're never going to get rid of it. You just want to reduce it and control it as best as you can. But by far, these first two categories are the major contributors, by far and away. So 2017, I data information, production has not gone down. It might be a little bit hard to read and to see. Hopefully you can get the PDF when this is done and blow it up in that. But the top 10 producers, you can see the Gulf area. Why the Gulf area? Well, that's where a lot of chemical plants are, and that's where some of the major sterilization facilities are located. And you can see there's two major sterilizations. 20% of the top 10 are sterilization units. The others are chemical manufacturers. And by far the greatest chemical that's being manufactured is the ethylene glycol or the antifreeze. And then you got your one lone contributor up there in the top 10 in the Virginia area. And you can see the kilograms there of what's being produced. Not to say that these are the only ones, these are just the top 10. So that was the first part here, just like I said, going through, the history and what it is, why it's a concern, where you find it, how is it produced, where it's produced, how much is produced, et cetera, et cetera. But to get into the second part here of what's new and what's going on with ethylene oxide, we can delve into that. So the first part here is what's going on with the Interstate Technology and Regulatory Council, or the ITRC. And I'm not sure if everyone here is aware of this organization. I was on it until just a couple of years ago, and I'm glad that I have found it. And I am actually now participating with and on the ITRC, but the mission of the ITRC, you can see there, is to produce a product and training of that product. And the product is a document. And what they are doing is providing the knowledge and the skills to assess environmental challenges within not just the U.S., but worldwide. And they have currently 12 teams that are involved in the environmental challenges that they have picked. And just to show you some of these that are mainly concerned would be the ETO, and I am a member of that team right now. I'll tell you what we're doing about it in the next couple of slides and where we're at on that. Passive monitors, which is a fairly new one. I have become a member of that, and we're in the early stages of parceling out what we need to do and who's going to be in charge of those committees, et cetera, et cetera. PFAS, if you haven't heard or seen these four letters, I'm not sure why you wouldn't have. It's been everywhere in the news. It's a buzzword. It's forever chemicals. It's what a lot of environmental labs are very concerned about right now and trying to do cleanup and monitoring, et cetera. But the ITRC has a team on that to pull together all the information that they're going to produce when they produce their paper. And then contaminants of emerging concern. This is, PFAS was one of those at one time. It's no longer a contaminant of emerging concern, but there's fire retardants and other things that people from the ITRC are working on extensively. But you can see that the ITRC is a state-led environmental coalition working to create these innovative solutions and best management practices. The only thing it produces are documents. In the document, you'll see what's involved in the produced document and how it goes about, and then the training that follows up with that document to get the technical knowledge and the quality, the regulatory decisions that need to be done, and how can we protect the health and safety of not only the people, but also the environment itself. So it states that it's in all 50 states, so it is a U.S. based entity. It doesn't have any legality as far as what it put out. I mean, it can only inform you as to what the findings are and how to go about with best practices. It's consensus based, but it's not any rulings or state mandates or federal mandates or anything like that. But the membership is created from all parts. You know, it's very diverse from state, federal, tribal, international agencies, members from academia, private sector, and the public. So we have, it's quite representative throughout all the different aspects of someone who can be a member of this. The one thing they do ask is that you participate once you become a member as you pick your team that you would like to participate on. So the ITRC ethylene oxide team document, this is what we've been working on, and we've been working on it for a couple of, at least 2 years, a year and a half to 2 years now, but we've created the document. The document is at least 80 or so typed pages right now with 10 sections of that document, and the document itself consists of the introduction, the properties, glossary, regulatory framework, potential uses and sources. Those are all things that we kind of, just building the background for the document that's being produced so that people are familiar with why it's being done and how it's being done, and where the uses are and where the sources are, what controls are in place, what can be in place, and what's going to be put into place, what's being done, what research, et cetera. The sampling analysis, that's the team that I was part of because of my background in analyses with the laboratory. I felt that that would be the best place that I could contribute, and I contribute based upon the knowledge that I have in dealing with ethylene oxide from a sampling and analysis standpoint. And I learned a lot from all the others too. So it's been a very enlightening experience. If anybody here in the webinar has a passion to contribute to the ITRC and the work that they're doing, you could look at the different teams that are out there and join the ITRC and become a member, and then join one of the teams and contribute to what they're doing. I think you'll find it very worthwhile. Of course, it's a voluntary organization, so it's not going to be your secondary gig or anything. Besides sampling analysis, then we have community engagement, which is a very big important part of this. Then we put in our references and acknowledgments. So it's going to be a very comprehensive document once it gets produced here. So we picked this up in February of this year, but way before the document was being created, first the team had to be put together. Then once the team was put together, the sub-chapters had to be picked upon, decided on what they were going to be. We had to find members to join those different chapters that needed to be done. And then everybody worked independently on their own chapters. They did it by Zoom meetings, by Teams meetings, in-person meetings when possible. These were bi-weekly, sometimes weekly, but the meetings were 2 hours long or so. A lot got accomplished within those meetings. Times, even within these individual meetings that you had, we had the sampling analysis committee that I was on was probably one of the largest membership committees that were out there of the 10 chapters there. And whenever you have 10 scientists, nerdy type people like myself together, everybody's got an opinion, and wordsmithing was taken to a new art form, and herding cats was the topic of the day. But we got it done. Then we'd all get together and we'd see the whole document produced from all the other team members that were putting together their sections. And then we all got to do our critique of all that, of all the people's other work, did wordsmithing, selected different diagrams that we thought were better, more charts, less charts, all that type of thing. So going through that internal review, finally putting the document together early this spring, and we sent it out to external review. And the external review we asked for volunteers from various academia, public, private sector, government, et cetera, so that they could review the document. They all had their, gave us back their feedback. Then we started doing our own, incorporating the edits that needed to be done. If we disagreed with some of the suggested editing or wordsmithing, et cetera, that went back and forth. Consensus was determined, and we are just now, we got a little bit behind, unfortunately, but we're just now, we're finishing up on that internal, we're finished with the external review. Now we're just putting it all back together. The drafting of the training document is being done. We are in the process of doing the web development, so we're a little bit, maybe a month or so behind. So this timeline is probably slipped to September at the earliest right now, but it's in progress. Let's put it that way. We didn't realize that we needed a lot more time to incorporate the external review of this document that we needed to make it the best product possible. But once we do that, there will be a website that'll go live with the document. Everyone can then go to it, bring it up, PDF it, et cetera, and look at what was developed and go through to make it, if you're a consultant, to use it in your consulting business, if you're an end user of the product, if you're a worker, if you're an owner of a chemical plant, et cetera, it's going to have a use for widespread use for everyone that deals with ethylene oxide. So hopefully we educated everyone that was not familiar with the ITRA, and now you are familiar with it. So that's good. And I encourage people that have the time and the ability to work with these chemicals that are concerned to look into contributing to that organization. So changing gears a little bit, going from that to the EPA. So just this year, the EPA has come out with two separate proposed regulations, one relating to the NESHAP for commercial sterilizers, and then the second is FIFRA, the Federal Insecticide, Fungicide, and Rodenticide Act, and I was unaware that that was actually a organization, but now I know. Anyway, these two proposals came out, the Federal Insecticide, Fungicide, and Rodenticide in April of this year. Used its federal authority under that act to propose, and these are proposed, increased protection for its workers and communities exposed to ETO when it's used in the sterilization. And it's actually the fumigation of ices and other food products, all under the FIFRA. So this is a proposed change. I say, because we're dealing with a federal agency, the FDA, I'm sorry, the EPA, the changes that will or can or should occur slowly. Justice, is slow. Anytime you're dealing with the federal agency, it's not going to be cut and dry. Here we go, happens next year type thing. So some of the highlights of that proposal, with the workers having personal protective equipment, anytime there's concentrations 10 parts per billion. And if you remember back on the slide when I said OSHA says you can be exposed to ETO as a worker at 1 part per million, And here, this is saying whenever you're above 10 parts per billion, you need to have the workers in PPE. And that part per billion is based upon real-time monitoring with an ETO sensor as opposed to collecting samples and sending them to the lab and then getting results 5-10 days later, et cetera. So this is a big deal. 10 parts per billion isn't very much, as you can imagine. If you've got a swimming pool filled with, you know, 1 million red tennis balls, and then you've got 10 white ones in there, it's not a whole lot. So anyway, this came out in April. I know this webinar here is in August, so it was out there for 60 days for comments. So that's closed. There's the hot link to where the regulation is. Again, since this is a federal agency, you know, things take time. Administration can go, priorities change, things happen. So where this is at in the lawmaking stage or approval stage, nobody really knows right now, except that it's in the pipeline. So the other standard that is being proposed is a little more broad in that it covers a lot more people and that would be involved. This looks like for the new risk measures for the interim identification required to complete the review, new risk assessment and completing the registration review. It's a lot of paperwork that's involved in this. And again, this came out around the same time this year. In the April of 2023, you can see that the 60-day time period just ended here, end of June. So it's been, six weeks or so that the time period has ended. So I'm sure that those comments are being gathered, compiled, and then there will be committees evaluating them, et cetera. So we're not anywhere close to having these things go out there and become into fruition. If any, let's see, okay, well, for some reason I did not put the link to this. Hopefully you can get it if you go back to the hot link that was on that other one. So that's the latest and greatest with the EPA that are involved in ETO, and I can tell you that there's not going to be any changes with the personal worker exposures that OSHA has with their PEL. Every once in a blue moon, OSHA will come out and change a permissible exposure limit, but those limits have been in place since the early 70s, and it is what it is with your own worker protection. But the public with the EPA and now the FDA, which is another federal organization that has gotten involved with ETO and trying to assist the other EPA and OSHA in mitigating and reducing emissions of ETO, not to protect the workers, not to do do anything like that, but how can manufacturers and these vendors, what can they do to help reduce the ETO concentrations that are being put out into the air? So the FDA set out to identify new sterilization methods and technologies. Now, the FDA doesn't create new methods and create new technologies, et cetera. They review, just like they review vaccines that come out, new foods, et cetera. Well, they approve methods that are produced for things like sterilization. And so they actually put out a request for new sterilization methods and technologies. And this was done in late 2019. And what they did, they put out the request. They got 24 submissions from these sterilization companies, and they did pick the top ones that were chosen. You can see them here. The Nova Sterilis, Noxialis, Steris, TSO3. They were chosen with their new sterilization technologies, and new sterilization technologies meaning replacing ETO as a sterilizer. So you can see the techniques that they were proposing using hydrogen peroxide on a couple of them, different radiates, NO2, even carbon dioxide. But as you can see, some of them are replacing one gas with another gas that has its own issues. NO2 has its issues. Radiation certainly has issues. H2O2, hydrogen peroxide, has their own issues. So this is more of a case of substitution, the lesser of two evil, maybe. And there's a hot link to the information about this challenge that went out by the FDA. Unfortunately, as I said, this was put out in late 2019, end of November. Within 60 days of these companies being chosen, the FDA was going to work with them closely to help modify and develop with their processes and maybe get this out into the public domain, et cetera. But we all know what happened in March of 2020 when everything hit the fan and the world almost stopped revolving with COVID. And so all of a sudden, the FDA, the administration, and just about anybody who was in the science field had something else on their mind and were trying to resolve other issues. And this kind of fell by the wayside, unfortunately. I don't know as of right now if it's been re-picked up or not, but at least this got people thinking about these different analytical techniques, different sterilization techniques, and maybe something will eventually come out of them and FDA can get back involved. And if FDA does get back involved, they really have a good emphasis on these companies in finding a solution to replacing ETO as a sterilizer. So the other proposal was, the other one was to replace ethylene oxide as a sterilizer. This other request was to reduce ethylene oxide emissions. If you're going to continue to use ethylene oxide, which you need to do in order to create the chemicals that are being created, like ethylene oxide, like ethylene glycol, et cetera, you really can't, substitute nitrogen dioxide or hydrogen peroxide or that. So you're still going to have a use and need for ethylene oxide, and whatever you do, you're going to have those emissions from those plants. So 22 applicants and 9 were chosen. Again, the same timeline, this end of November 2019 is when this was done, the same process, 60-day review, et cetera. But you can see that here's some of the chemical plant companies that were chosen to help figure out how they can reduce their ethylene oxide emissions. Again, end of 2019, March 2020, people had different priorities, and we're still, on the back end of that, trying to figure out, what should we do now with these ethylene oxide emissions. So it's nice to see the FDA getting involved in this. It's nice to see sterilization organizations taking up the sword to see what they can do. And it's also nice to see that these chemical manufacturing companies also wanted to take up the good fight. So there's good things out there that were set in motion, and hopefully we can get back to following through and getting our substitution for ethylene oxide sterilization, and also just the plain reduction of ethylene oxide emissions. And with that, I come to an end. My contact information is there, and I believe we have time for questions that I will try to answer. If not, I will get back to, I'll work it out with the AHA how I can get these questions back or answers back to everyone. But thank you for your time, and hopefully it was something that you got at least one nugget out of it. Thank you again.
Okay, great. Thanks, Ed. Yeah, it looks like we have about 13 or 14 minutes left for questions. Just a reminder, if you'd like to ask a question, please type it into the chat window on the right side of your screen and send it to everyone. The first question I have, Ed, is what method was improved for ETO detection? I guess they're asking if it was TO15 and when was the method improved?
Yeah, it was definitely TO15 and it was not over an 8-hour period. It was over, I believe, a 24-hour period. That's typically what the EPA would do when they're looking at the public domain, because it's not just a working day that you would be exposed to it. It would be a 24-hour period that you would be exposed, and it is TO15. Was there another part of that question? Okay.
Nope, that was it for that one. The next question I have is which direct reading instruments provide good results for ETO?
I'm sorry, which instruments? Which
direct reading instruments provide the best results? Yep. Well,
okay, so I full disclosure, I work for a commercial laboratory. We do provide a direct read instrument. Well, let me put it this way: I'm not familiar with any direct read instruments that are set up for ETO as an instrument. I'm sure that there are out there, but the reason that we do not use that type of instrument is because you can just use a commercially available ETO sensor, say from Honeywell or 3M, a alpha sensor, et cetera, that produces an ETO sensor that can be plugged right into an instrument like a multi-ray instrument or a Honeywell instrument, or et cetera. We produce an instrument that does the same thing, that we just take the ETO sensor and put it in there. The only thing the sensor technology has come a long way, and they're using more and more sensors in both ambient air monitoring, indoor air monitoring, and personal monitoring, and the sensitivities have come way down, and the cross interferences have gone away on a lot of them. But I would feel comfortable if somebody would just Google ETO sensors and see what's available, and then they can go into your typical instrument. Or if you wanted to, you could purchase probably an ETO direct read instrument itself. The one to look at are the cross interferences that you might have with that particular sensor, and what the detection limit is, what the sensitivity is.
Okay, thanks. The next question I have, someone says there was mention that ETO was used in the sterilization process for COVID nasal swabs. Is this a health concern or cancer risk?
I was unaware of that, actually. So they sterilized, well, it doesn't surprise me because, whether it's a scalpel, whether it's an H bandage, whether it's sutures, whether it's a dental, probes, dental drills, all those things, they're all using, not all, but a lot of the sterilization processes is the ETO. There should not be, let's put it that way, the sterilization companies realize that, there could be potentially an issue with ETO, but they give time for the off-gassing, and they're doing monitoring of the equipment before they're being packaged. So there should, not, but you should be concerned, and there should not be an issue with ETO as an exposure for the use of, just like you wouldn't be concerned if you're at the dentist and they open up a pack of, they open up the pack of the dental picks and that's sterilized. So, yeah.
Okay, thank you. The next question is there any concern that the ETO would degrade after some time in a collection canister?
There hasn't been any demonstration of that. We do a lot of ETO in canisters, and well, we haven't done a term study. Let's put it that way. So we typically know that there's not a deviation when we do our in-house testing for stability, that within five to 7 business days, there's not a degradation or a loss of ETO going from ETO down to and there shouldn't be a fact that samples typically are not going to be held on to any longer than that typical 5 to 7, maybe 10-day range. So from what we've seen and what we have for studies, there is no issue on that. And I know that the EPA, when they're doing their ambient air type testing on some of these long-term, on some of these facilities, they're putting canisters out there for a week at a time. So they're collecting samples over a week period and sending them back into their own laboratories for analysis. And so they probably have a lot more data than what we have on the stability, but they know that at least 7 days, and we know that for a fact also that there's no issue.
Okay, got it. The next question I have, hopefully I'm pronouncing this right. They say in the past we had SUMA canisters for TO15 batch certified instead of individually certified by Galson before testing. Is there a significant difference in sample reliability with the batch certifications? No.
Well, first, to explain to people about that, a batch certification is you clean a set of canisters through the cleaning process, which is purging with inert gas, filling it, running it, looking for any artifacts or anything that might be left. When you do a batch certification, you're taking one of the cans that in the series that has been cleaned and running it through the full QC, and then all cans that were run with that one can that was certified are considered part of the batch and are considered clean. Individual certification of cans is every single can that you get is certified and analyzed to be clean. Typically, you're not going to have any issues with batch cleaning. It's been proven that good QC and cleaning processes should not give you any issues. The reason individual batch cleaning is requested or done is because it might be a high-profile case. It might be a court litigation type case. It might be a workers' comp case, where the more quality control data you have, just like the more samples you have, the better you're going to be able to defend your position or disprove your opponent's position. So some work plans request some work plans will request individual certification and some won't. It's your prerogative to choose an individual can certification if so desired. The reason it's not done all the time for all the samples by all the labs is the cost is greatly increased to the client when that is done. And if it's an unnecessary cost to the client, then the labs really don't want to pass that along. So for most cases, it's not required, and it's not really a big difference.
Okay, got it. The next question is, do you know if there are ITRC participants in Puerto Rico for ETO?
No, there is not, to my knowledge.
Okay, thanks. The next question I have is there any concern with employee exposure to off-gassing after sterilization when the product is shipped to the distribution center or employees unloading the loads? There was some discussion if anyone had seen overexposure for these employees, but if there's anything you had to add, Ed, that would be great.
That's a great question, actually. Again, there should not, and I emphasize the word should not be, because the processes that are put in place at the facilities, for the sterilization facilities, should include the final clearance, sampling, and detection of any potential ETO that might be off-gassing from the products that are being sterilized. I can't say that that's true for all the facilities that are doing that, but I personally, and as far as I know from our laboratory standpoint, we have not seen any employee exposures from, saying, somebody receiving a pallet of medical equipment that has been sterilized by ETO, opening up in a warehouse and having ETO potential exposures. Not to say it couldn't happen, but just like anything else, the odds are if all processes are being adhered to, there shouldn't be an issue. Really, the big issues with employee exposure is at the source itself, where you're using it in the chemical manufacturing process or in the actual sterilization process. Once you get through those two processes, ETO is going to off-gas very quickly, and once it's become ethylene glycol, you should be all set. But that's again, so getting a pallet full of sterilized medical equipment and opening up, there shouldn't be an issue there.
Okay, got it. I think we've got time for just one more question, unfortunately.
Oh, okay.
So EPA, we do have some more questions, but Ed, we will pass those on to you. So
Please,
you'll be able to, so let me see. So EPA T015 is for measuring ETO in air. Is there a similar method for in water sources?
No, and I have to profess my ignorance on this, but I can certainly look at it and research it for you. But I spent 40 years in the air industry for sampling and analysis in a couple of different laboratories and that, but I have very little experience with environmental, water, soil, hazardous waste methodologies and sampling and analysis techniques. So I would say, because it is a chemical and it's a chemical of concern, it's a cancer-causing chemical that, and it's a gas that can be in water, dissolved and part of water. I am almost 100% sure that there are analytical techniques for water. It's a volatile compound, so you would treat it like you would collect for other VOCs, with no headspace in a volatile vial that would then be analyzed within probably 24 hours once it's collected. But I don't have an analytical, an EPA or an SW846 method for it offhand, because I'm just not familiar with those types of methods. But if Kay or whoever can pass that information or that question along to me, I can add it to the other questions that I can answer for you.
Yep, that sounds good. Unfortunately, that's all the time we have for today. We will be sharing all questions from today's event with SGS Golson and Ed. So if we didn't get to your question, please know that we will pass it along. My thanks to Ed Stuber for his presentation, to SGS Golson for sponsoring today's webinar, and to all of our participants. Please visit aiha.webvent.tv in the coming weeks for information about more new Synergist webinars later this year. Thanks to everyone again, and have a great day.